And the hypothesis of this study was that if I used something immersive like Acadicus and made a recording that showed them all the steps and really described to them all the pitfalls that they might come towards in setting up for an intubation, a pediatric intubation, and went over all the pieces of equipment in detail, and I made a recording of that and then put them in the headset, let them watch that recording, experience it. And as John pointed out, in Acadicus, they can really be in the video with me. So they're not just watching a recording, they're handling all the equipment with me. The hypothesis was when they were done that, we would test them outside of VR and see how much do you recall, how much do you remember, how many of the steps did you get right? And the hypothesis was that they would perform as well as my upper year fellows, my second and third year fellows who have set up for pediatric intubation probably 100 times by the time they're done their second and third year fellowship. But I think the difference that comes with the immersive 3D sim is that I'm not having those students and fellows and residents just sitting down and watching something on a computer. They're putting on the headset and they are part of the simulation with me. So they're watching my recording pick up a laryngoscope, and then they can pick up the laryngoscope. Oh, I have to hold it like this. I have to hold it in my left hand. I'm supposed to check and make sure the light works. Okay, the light seems to be on. They can pick up the breathing tube. They can make sure the cuff inflates. They can make sure the is set properly. They can measure it out and make sure that they have the right size. They can simulate bag mask ventilation. So supporting the patient until we're ready to put the breathing tube in. We take a mask, put it over the nose and mouth of the patient, and deliver oxygen breaths and make the chest go up and down so that they don't desaturate when it comes time to put the breathing tube in. So they're not just seeing the avatar, the recorded avatar, do all the steps. They're then doing the steps themselves. So all told in the study, they would spend about 20 minutes or so in the headset. They'd watch about 15 minutes of the video, the recorded video, doing some of the steps along with my avatar. And then they'd spend another 5 minutes or so kind of picking up all the equipment. Okay, I need a bag and mask. I need suction. I need a breathing tube of the proper size. I need an oral airway. I need an NP airway. I want to make sure I have an end-tidal CO2 detector to make sure that the tube's in good position. And then we take them out of the headset, bring them into another room that had a traditional plastic mannequin with a box full of equipment, and said, set up the room to get ready to intubate this mannequin. Try to remember all the steps that you learned, walk through the checklist, and scored them. And what turned out to be the truth for the experiment, which was small, we had about 7 or 8 people in the VR group, and then we had about 9 of our critical care fellows who were upper years. But what we found was that they scored appropriately. The novice airway setter-uppers, for lack of a better term, remembered as many steps as my upper year fellows who had done it probably 100 times by then. So we thought the conclusion we came to was that VR is really an appropriate vehicle to teach medical education and simulation. To learn medical education, you can go through that 3 years of residency and 3 years of fellowship, and you hope that you come across lots of different patients with lots of different diseases, and you are exposed to lots of things to help you learn. But the reality is in 2020 that volumes, especially in pediatric hospitals, are down. So your exposure to sick patients is less. And the other reality is that nobody's going to let a novice doctor practice a potentially dangerous procedure on a patient, whether it's a child or an adult. Could we make a medical simulation, a medical video game where you really felt like you were in the game? You were the doctor performing the procedure in real time. There were high stakes. There was pressure if you didn't get it right. And, you know, what I found with putting that headset on and being in an immersive environment like Acadicus is it really ratchets up that reality factor. They immersed themselves in the video and participated instead of just watching. They started picking up tools themselves. And then when we translated them back into the real world and said, all right, do it again, show us what you can do, they had great recall that was comparable to our advanced fellows who had been doing this over and over again in their jobs for the past 2 and 3 years. What I would love is that, kind of the next step in medical education is not when you get admitted to NYU Langone on your first day of medical school, they hand you a laptop or they hand you an iPad. I want those students to get a VR headset and get a laptop that can drive a high fidelity simulation like Acadicus on day one. Each student having their own VR sim, how great would it be for them early on to put a headset on and say, I've never met a patient, but I'm going to do the pediatric airway readiness scenario today, or I'm going to do an adult status epilepticus seizure scenario today, because someday I'm going to deal with that. And they can do it as many times as they want. They can mess it up as much as they want because they're a first-year medical student. They don't know that much clinical medicine, but they're going to learn some through being in a VR headset and practicing it in an environment that seems so real that it's hard for them to tell the difference. And maybe one of them is on the West Coast at Stanford Medical School, and maybe one's on the East Coast in Boston, and maybe one's in Texas at Baylor. But all those folks could be in Acadicus, in a mock code together, bringing their own learning from whatever coast they're on, their medical school background, and they can all work together, communicate as if they're in the same room in real time. They can see each other's avatar, they can hear each other, and they can watch each other execute the steps and coordinate that. And there's not enough that can be said about practicing that teamwork. The more people see how cool this is and how realistic it is, I think more people will want to get